Imagine this. You feel healthy, strong, and capable. You go about your day without thinking twice about your body. Then slowly, subtle changes creep in. You start waking up more often at night. You notice minor discomfort when using the restroom. Or you experience fatigue that you can't quite explain. These little shifts are easy to brush off as stress, aging, or even bad habits. But what if these seemingly harmless signals were actually your body's way of warning you about something far more serious? Something that could endanger your life if ignored. Prostate cancer is one of the most common cancers in men, yet it often develops silently. By the time many men recognize the symptoms, the disease has already advanced. This is why understanding the early warning signs can make the difference between life and death. In this video, I'm going to show you the 7 critical early signs of prostate cancer that every man needs to know right now. These are not random health tips or exaggerated warnings. These are medically recognized symptoms that, if detected early, give you the chance to act quickly and protect your health. So, stay with me as we uncover each one, because ignoring even a single symptom could cost you dearly. And by the end of this video, you'll not only know what to look for, you'll also know the best next steps to take if you notice any of them. Your health is your greatest asset. Don't gamble with it. Let's begin. Here's the real danger with prostate cancer. It rarely makes a loud entrance. Unlike heart attacks or strokes, which come suddenly and dramatically, prostate cancer often moves quietly in the background. For many men, the earliest symptoms are so subtle that they're mistaken for ordinary signs of aging. A slower urine stream, fatigue, or discomfort in the lower body might be brushed off as just getting older. That false assumption is what allows the disease to progress unnoticed. The prostate itself is a small gland, about the size of a walnut, located just below the bladder. Its main job is to produce fluid that nourishes and protects sperm. Because of its position in the body, even small changes in the prostate can affect urination, sexual function, and pelvic comfort. But here's the problem. Men often don't pay attention to these changes until they become too severe to ignore. By that point, cancer may have already spread beyond the prostate, making treatment far more difficult. The tragedy is that early-stage prostate cancer is often very treatable. In fact, when caught early, survival rates are extremely high. The challenge is simply recognizing the warning signs before it's too late. That's why knowledge is so critical. It empowers you to notice patterns in your health that others might dismiss, and it pushes you to seek help before the problem grows. In this video, we're breaking through the silence. I'm not here to alarm you. I'm here to arm you with awareness. Because when it comes to prostate cancer, silence is not golden. It's dangerous. Now that we understand why prostate cancer is often missed, let's look at why awareness can literally save your life. Awareness is not just about knowing facts. It's about survival. Prostate cancer is one of the most commonly diagnosed cancers among men worldwide. Yet it is also one of the most survivable when caught early. According to global cancer statistics, more than 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That number alone should cause us to pause. But here's the crucial difference. Men who detect the disease early have a survival rate of more than 95%, while those who discover it late face much tougher odds. Why does this matter? Because most men don't talk about their health. Many are conditioned to tough it out, to ignore discomfort, or to believe that seeking help is a sign of weakness. That silence, combined with the hidden nature of prostate cancer, creates the perfect storm. By the time the illness forces a man to the doctor, the cancer may already have spread beyond the prostate gland into the bones or lymph nodes. At that stage, treatment becomes more complex, recovery more uncertain, and quality of life more fragile. Awareness shatters that cycle. When you know the early warning signs, you are more likely to take note of subtle changes in your body. You're more likely to seek medical evaluation, get a PSA blood test, or request a digital rectal exam, all of which can detect prostate issues at an early stage. This is not about fear. It is about empowerment. The earlier you act, the more options you have, and the greater your chances of returning to full health. So, with this in mind, let us turn to the first critical sign you should never ignore: frequent nighttime urination. One of the earliest and most overlooked signs of prostate cancer is frequent nighttime urination, also called nocturia. Many men wake up once at night to use the restroom, and that can be normal. But when you find yourself getting up 2, 3, or even more times every night, it may signal an underlying problem with the prostate. The reason is simple. The prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When the prostate becomes enlarged or affected by cancer, it can press against the bladder and urethra. This pressure creates the constant urge to urinate, even when the bladder isn't full. At night, when your body is at rest, that pressure becomes more noticeable, interrupting your sleep repeatedly. Now, it's important to note that not all frequent urination is caused by cancer. Conditions such as benign prostatic hyperplasia, BPH, urinary tract infections, or even diabetes can cause similar symptoms. However, the danger lies in assuming it's always something minor. If nocturia becomes persistent, it deserves medical evaluation. Why is this sign so critical? Because it's often the first noticeable change a man experiences. It disrupts sleep, affects daily energy, and signals that something in the urinary system is not functioning as it should. Ignoring it is like ignoring a warning light on your car's dashboard. The light may not tell you the exact problem, but it tells you something is wrong. So, if you notice you're waking up more often at night, don't brush it off as just aging. Speak with your doctor. A simple check could determine whether it's harmless or an early sign of something serious. Next, let's move to the second early warning sign: difficulty starting or stopping urination. Another critical sign that may point to prostate cancer is difficulty in starting or stopping the flow of urine. Many men describe it as standing over the toilet and waiting longer than usual for urine to begin, or feeling like the stream just won't come smoothly. Others notice that once they finish, the urine continues to drip or trickle, as though the bladder cannot completely shut off. This happens because the prostate gland, when enlarged or affected by cancer, can interfere with the urethra, the narrow tube that carries urine from the bladder out of the body. Think of it like a kink in a garden hose. Even when the water is there, the pressure can't push through properly. The result is hesitancy when trying to start urinating, or difficulty when trying to stop. Now, occasional trouble with urination is not always cause for alarm. Stress, dehydration, or even certain medications can affect bladder control. But when this becomes a regular pattern, it should not be ignored. Persistent urinary hesitation or dribbling can indicate that the prostate is obstructing the natural flow, and in some cases, that obstruction may be caused by cancerous growth. This symptom also carries another layer of concern. Incomplete emptying of the bladder can lead to repeated trips to the restroom, infections, or even kidney strain over time. It's not just an inconvenience. It's a warning that something deeper may be wrong. If you find yourself regularly waiting for the flow to begin, or struggling to stop completely, consider it a sign worth investigating. The body rarely gives repeated signals without reason. Getting checked early could save you from much greater problems later on. Next, let's look at the third warning sign: a weak or interrupted urine flow. A strong, steady stream of urine is something most men take for granted, until it changes. One of the hallmark early signs of prostate trouble, including prostate cancer, is a weak or interrupted urine flow. You may notice that the stream doesn't have the same force it once did, or that it stops and starts unexpectedly during urination. This symptom occurs because the prostate surrounds the urethra, the channel through which urine passes. When the prostate becomes enlarged or obstructed by cancerous tissue, it narrows the passageway. Imagine trying to pour water through a pinched straw. The flow weakens, stutters, and sometimes cuts off altogether. That same effect happens when the urethra is restricted by changes in the prostate. A weak stream on its own might seem like a small inconvenience, but it carries deeper implications. First, it often means the bladder is struggling to push urine past the obstruction, which over time can weaken the bladder muscles. Second, it may leave residual urine behind, increasing the risk of infection. Most importantly, it is a sign that should never be dismissed as normal aging, especially if it comes on gradually and persists. Not every case of weak urine flow points directly to prostate cancer. Benign prostatic hyperplasia, BPH, is a very common cause, especially in older men. But that overlap of symptoms is exactly why medical evaluation is essential. You cannot know what's happening inside your body without proper testing. If you notice that your urine flow has lost strength, or if you experience frequent interruptions midstream, consider it a red flag. The earlier you investigate, the better your chances of identifying the cause and treating it effectively. Up next, we turn to a symptom that no man should ever overlook: the presence of blood in urine or semen. Few symptoms are as alarming as noticing blood where it should never be, whether in your urine or semen. This condition, called hematuria, blood in urine, or hematospermia, blood in semen, is one of the most serious warning signs of prostate problems, including cancer. While the sight of blood may appear faint or even come and go, it should never be ignored. Here's why it happens. The prostate is located near delicate blood vessels. When cancer begins to grow in or around the gland, it can damage these vessels, causing small amounts of blood to leak into the urinary tract or reproductive system. Sometimes the bleeding is visible, producing pink, red, or rust-colored fluid. Other times, the blood may only be detectable under a microscope during routine tests. It's important to understand that blood in urine or semen doesn't always mean cancer. It can also result from infections, kidney stones, or even medical procedures. However, because of the serious implications, any instance of unexplained blood requires prompt medical evaluation. This is not a symptom to watch and wait. It demands immediate attention. The real danger lies in dismissing it. Many men may convince themselves that the bleeding is a one-time occurrence or the result of strain, but ignoring it allows time for a potential cancer to grow silently. Early medical intervention, on the other hand, can uncover the exact cause and ensure that treatment begins while it's still effective. Think of blood in urine or semen as your body's urgent alarm bell. It is telling you, loudly and clearly, that something is wrong. If you ever encounter this sign, treat it as an emergency, not an inconvenience. Next, let's look at another symptom that is often misdiagnosed as something minor: pain or burning during urination. One of the most uncomfortable and often misunderstood signs of prostate trouble is a painful or burning sensation during urination. Men who experience this often assume it must be a urinary tract infection or perhaps irritation from dehydration. And while those can be causes, persistent discomfort when passing urine may also point to prostate cancer. The prostate gland, when inflamed or affected by abnormal cell growth, can irritate the surrounding tissues of the bladder and urethra. This irritation creates that sharp or burning feeling every time urine passes through. Some men describe it as a stinging pain. Others say it feels like pressure or heat in the lower abdomen. Regardless of how it presents, it's a sign that something deeper may be wrong. It's worth noting that painful urination does not automatically mean cancer. In fact, infections such as prostatitis or sexually transmitted diseases can cause similar sensations. But here's the critical distinction. When the pain lingers, returns frequently, or appears alongside other symptoms like weak urine flow, frequent urination, or pelvic discomfort, it raises a much stronger concern about the prostate itself. Why does this matter? Because pain is the body's way of drawing attention to an issue that cannot be ignored. Too many men try to mask the discomfort, drink more water, or self-medicate with antibiotics without a clear diagnosis. That delay could allow cancer to grow undetected. If you notice persistent burning or pain during urination, don't guess the cause. Don't assume it's minor. Seek medical advice and demand proper testing. Whether the diagnosis turns out to be infection, inflammation, or something more serious, the sooner you know, the sooner you can act. Now, let's turn to two more signs that often appear together: unexplained pelvic discomfort and erectile issues. Signs number 6 and number 7, pelvic discomfort and erectile issues. Two signs that often appear together, yet are frequently overlooked, are pelvic discomfort and erectile problems. These symptoms may not be as obvious as blood in the urine or a weak stream, but they can reveal important changes in the prostate that should not be ignored. Pelvic discomfort usually presents as a dull, persistent ache in the lower back, hips, thighs, or just below the waistline. Many men dismiss this as muscle strain, arthritis, or simple aging, but when the pain lingers or cannot be explained by physical activity, it may be connected to changes in the prostate. Cancerous growth can irritate surrounding nerves and tissues, producing that deep, nagging discomfort that never quite goes away. Erectile issues are another red flag. Men experiencing difficulty achieving or maintaining an erection often blame stress, fatigue, or emotional strain. And while those factors play a role, persistent erectile dysfunction can also point to prostate problems. Cancer in the prostate or treatments affecting the gland can disrupt the blood flow and nerve signals that are essential for sexual function. The challenge here is that both symptoms, pelvic discomfort and erectile dysfunction, can have multiple causes. However, when they appear together or alongside the other warning signs we've discussed, they create a clearer picture that the prostate may be involved. This is why ignoring these changes is so dangerous. What seems like an inconvenience in daily life could actually be an early warning of something much more serious. Instead of brushing them off, men should see them as signals that demand closer attention. When your body speaks through pain, weakness, or dysfunction, it is asking you to listen. Acting early could save not only your health, but also your quality of life. Now, let's bring everything together with the solution and the steps you must take if you notice any of these 7 critical signs. We've walked through 7 critical early warning signs of prostate cancer. Frequent nighttime urination, difficulty starting or stopping urination, weak or interrupted urine flow, blood in urine or semen, pain or burning during urination, pelvic discomfort, erectile issues. Each of these symptoms on its own may not confirm cancer, but when they persist, repeat, or appear in combination, they are your body's way of waving a red flag. Ignoring them is not worth the risk. So, what should you do if you've recognized one or more of these signs in yourself or someone you love? The first step is simple but vital. See a doctor immediately. A primary care physician or urologist can run straightforward tests, such as a PSA blood test or a digital rectal exam. These may sound uncomfortable, but they are far less painful than discovering cancer too late. Early detection makes treatment easier, recovery quicker, and survival rates dramatically higher. The second step is regular screening, especially for men over 50, or earlier if you have a family history of prostate cancer. Proactivity is not paranoia, it is wisdom. By scheduling routine checkups, you give yourself the best chance to stay ahead of disease. Finally, the third step is awareness and action. Share this knowledge. Too many men suffer in silence, unaware that small symptoms may be signs of a bigger issue. By speaking up and encouraging others to pay attention, you could save more than one life. Your health is not something to gamble with. If any of these signs sound familiar, don't wait, don't guess, and don't ignore them. Make the call. Get checked. Protect your future. Thank you for watching. Stay informed, stay proactive, and take care of your health. It is the foundation for everything else in life.